Hello everyone, my name is Shima Salim. I will be presenting for my group. My group members are Maria, Sabrina, and Rajan. And the question that we have is, how do patients choose a medical practice? Referrals. Referrals can be from friends or relatives who recommends a medical practice from their personal experience, including their success rate of the treatment and how they were treated. Doctors, reviews, online reviews, and star ratings are the most important factor in choosing a new healthcare provider. According to a survey from Press Ganey, a provider of patient satisfaction surveys, according to the data, this online information is more important to consumers in selecting a patient than another doctor's referral and is more than twice as important when choosing a primary care physician. In fact, 83% of respondents said they went online to read the reviews of a physician after receiving a referral from another provider. Language. Language is another important factor to check when you need to be able to communicate clearly with your doctor. So check which languages he or she speaks to be sure you'll be able to understand each other. Race or sex is another important factor to consider when choosing a physician, um, including their specialists and board certifications and insurance coverage. Costs. Cost is also another reason of of when choosing. Insurance. Insurance payments for services within a designated network varies based on whether the plan is in-network or out-network. In-network services, you'll be responsible for co-payments and the deductibles. Out-network, you're typically not covered unless you are with an emergency. For checkups, the U.S. healthcare system spends about $300 million a year on unnecessary tests that are ordered in annual physicals. Billions more are spent on follow-up tests and treatments. To improve the quality of care they provide, doctors should understand their patients' preferences. Medical uncertainty, deficiencies in individuals' doctors' knowledge, and highly variable ability of patients to understand and remember clinical information means that risk communication is often inadequate to support patients in making informed decisions. Check to see if a doctor is board certified in that area. The American Board of Medical Specialties maintain a searchable database of board certified doctors called Certification Matters. According to the JMA Dermatology Journal, patients who have an insurance plan will likely choose from wherever their insurance is accepted, with the exception of paying non-insurance pricing. Choosing the right insurance plan is also a determining factor, as well as because based on what was found, it is evidence that covered patients experienced better treatment and improved inconvenience. It is important to note that many physicians practice in multiple locations. When the search for a new practice is narrowed down to only insurance covered physicians, it is ideal for prospective patients to narrow their search more by only looking for practices within a certain mile radius. For more specialized care, patients will travel longer distances in order to receive the treatment they need or want. As for insurance plans, providers have the right to not take select insurances at any time. This is a disadvantage to those who are seeking regularly scheduled care and puts them in a position where they're either to have to pay for non-insurance pricing or find a new provider altogether. Cosmetic procedures, decision-making process for patients when doing an elective aesthetic surgery. Majority of the patients had been considering surgery for several years. They primarily conducted their research on the internet and received information from other non-aesthetic physician general practitioners. The most crucial attribute of a surgeon was thought to be competence. The attribute, on the other hand, was evaluated based on a subjective criteria. Environment, office space, and personnel were rated as important, but not extremely so. Surgical costs were placed second. The aesthetic results as well as potential issues and complications were requested. Patients came based on the information found on the internet and referrals from other doctors. Because of positive patient-doctor communication and the physician's good reputation, 60% of all interviewees did not see another surgeon and decided to have the operation. We need to fully understand the way in which the combination of demographic, social, and psychological factors influence decision making to undergo cosmetic surgery. Cost risk was not important in decision making to undergo cosmetic surgery. Surgery. How do patients choose a practice and/or surgeon? A systematic review of the literature on how patients choose surgical care was conducted using the Medline PubMed electronic database, and it was concluded that patients consider a variety of factors when selecting a surgeon, and the circumstances surrounding patients' decision may differ based on the socio-demographic, cultural, and other factors. More information on how patients select surgeons or hospitals will assist providers in helping patients in finding their preferred caregivers. The most highly appreciated professional traits for surgeons were their reputation and competency. Patients frequently choose surgeons depending on their ability to connect with them. Many patients choose surgical care based on hospital characteristics rather than surgeon qualifications. For these patients, hospital reputation and distance were the most important concerns. When it came to choosing a surgeon, most patients depended on word of mouth and medical referrals. Patients also reported an interest in having access to high quality information about surgeons, indicating that this information would be helpful in making decisions. Specialists. Patients with or without internet access can easily access information on an expert, such as professional qualifications and academic accomplishments. However, all patients, regardless of gender or age, tend to value suggestions and referrals, as well as constant care from the same treating physician. A referral to a specialist is a common decision made by physicians in a variety of healthcare systems and is influenced by a number of factors. Referral rates vary by country, but they range from 1 in 10 to 1 in 20 appointments. Out-of-pocket costs were the most crucial factor for patients. Costs can influence referral decisions for patients in private healthcare systems. However, while cost was a consideration, it did not take precedence in the decision-making process. Collaboration and communication between the specialist and primary care physician were second to most essential characteristics. The third factor to consider was whether or not specialists used shared decision-making. Consider patient-centered care throughout the care route, shifting the focus away from discrete treatment decision points and prompting us to consider patient preference in referral process upstream. Previous research has indicated that patients value shared decision making more when it is really experienced by them, and the same may be true when patients are involved in the referral process. Patients seek for physicians who practice collaborative decision making and greater communication among clinicians. The patient may want to know that the expert visit will be valuable in terms of both money and time, and the physician will obtain the specialized advice they ask in order to deliver the best possible care. The report also emphasizes the value of primary care physicians to patients as a trusted counselors and champions for their health. Medical tourism. Medical tourism is becoming an extremely popular option for many patients, especially those in the United States that tend to have to pay out of pocket, and they search from other countries due to the lack of affordability, lack of availability, and a lengthy waiting list in their own home country. Many patients are influenced into going abroad in order to keep healthcare costs low. Employers and insurance companies are encouraging people to access surgeries abroad and in order to have a higher standard of care than residents of the country itself. And lastly, economic factors. There's a lot of transparency with healthcare costs and with patients. In fact, Americans support price shopping for healthcare, but very few actually seek out price information. Theoretically, patients with higher deductibles and lower income would be more likely to be financially motivated to price shop for care. In fact, non-Hispanic blacks, 63%, were more likely to be aware of the price before receiving care compared to non-Hispanic whites, 54%, and Hispanics, 49%. These are our references, and thank you so much for listening.